Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is an overview of RSD and CRPS. Well, RSD stands for reflex sympathetic dystrophy. CRPS is complex regional pain syndrome. Both represent chronic pain neurologic syndromes that are extremely frustrating to both patients and doctors. The basic problem is that you have an overactivity of the sympathetic nervous system that results from either trauma or surgery or some unknown cause. In the early 90s, the International Association for the Study of Pain changed the name from RSD to CRPS to try and better characterize the condition, but both terms are still used interchangeably in the public's repertoire. How common is the problem? Well, total numbers are unclear, but it looks like there's somewhere between 5 and 12 million Americans suffering from RSD, CRPS. 3/4 of those are female, and it's unclear why exactly it occurs. We know you have overactivity of the autonomic nervous system, specifically the sympathetic part. The trigger, whether it's surgery, trauma, or something minor, it just sparks up the autonomic nervous system and it just doesn't shut it off. Symptoms, there's quite a few. It may include severe burning pain that is intense and much stronger than you would expect for the injury sustained. The pain typically gets worse over time rather than better. It starts at the point of injury, but it can spread to the whole leg or arm and then even start to encompass the other side. Oftentimes, patients early on have significant sweating, swelling in the tissues, extreme sensitivity to the affected area, bone and skin changes can be seen, and then it can develop insomnia and emotional problems. There are 3 stages. The first stage involves 1 to 3 months. You start to see skin temperature changes, muscle spasms, severe burning pain. It worsens with even a slight touch, like a sheet touching the skin. Hair and nail growth becomes faster than normal, and you start to get some skin changes, sweating, shiny skin, blotchy and pale. When you get into the 3 to 6 month period, you start to get more skin changes, the nails start to crack, the pain continues to get worse, hair growth slows down, and you start to get weak muscles and stiffening joints because it hurts to move it. So it starts to get atrophy and starts to become stiff. And in the 3rd stage, it becomes irreversible. You start to get real bad muscle wasting. It can spread into the entire arm or leg, and then you start to get contractions. It's so stiff and you haven't felt like moving it that now you can't move it because it's contracted. RSD and CRPS are very hard conditions to cure, but they can be slowed and reversed significantly. Various options might include physical therapy, medications such as narcotic medication, antidepressants, which are commonly used off-label for RSD, blood pressure medication, same thing, off-label, anti-inflammatories, steroid medications, neuropathic medications like Neurontin or Lyrica, even calcitonin can benefit. For the lower extremity issues, lumbar sympathetic blocks can be very good, and for the upper extremity, a stellate ganglion nerve block can be very helpful. You can see those here. You can see that the needle goes around the whole spine and into the area where the sympathetic nerves are, and that can be very helpful. If that works and then wears off, you can either repeat it or do a surgical sympathectomy, which is where the sympathetic block nerves are taken out. Okay? A spinal cord stimulator or an intrathecal drug pump can be an excellent last resort options to provide pain relief. What are the treatment outcomes? Well, earlier treatments work better. We do know that. Back in the 80s, there was a large study showing that if treatment was started within 2 years of onset, you can get an 80% good to excellent outcome. 2 to 5 years is 70%, and anything outside of that is pretty low outcomes, which is 10 to 20% good to excellent. Now, keep in mind that was over 30 years ago, so now we have better treatment options. So these are probably more like 85, 75 to 80, 30. We don't have those new studies, but I'm just imagining. The Annals of Neurology in 2004 looked at spinal cord stimulator for RSD in over 50 patients and showed extremely favorable long-term outcomes with some minor complications. Now, moving from a laying to a standing position is not such a big issue. The older implants didn't really respond well to that, but the newer ones are technologically advanced. So there are significantly good options for treatment. Lumbar sympathetic block is when anesthetic is injected into the stellate or lumbar sympathetic ganglia. You know it works if it immediately warms the skin. Pain relief may occur within a half hour and can last for days to weeks. You may need 1 to 2 blocks per week with about 5 to relieve the symptoms permanently. And then, like I mentioned, operative sympathetic may become necessary. RSD and CRPS is complicated. It's due to all that we don't know and the varied presentation. So combination individualized treatments are typically best and lead to the most successful outcomes. The goal is to break the cycle of the sympathetic overactivity. If you can break the cycle, you can work towards a really successful outcome. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. In the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.